Hey y'all, I'm Dr. Bayarka Perez. Welcome to the breakdown. Today, I'm going to break down bipolar disorder. Now, the term bipolar is frequently used inaccurately. So today we'll talk about what bipolar is and what it is not. By definition, bipolar disorder is a mental disorder that involves unusual shifts in emotions, daily activities, ability to complete day-to-day tasks. Now, these mood shifts are called mood episodes. A mood episode is not the same as a mood swing that most of us experience from time to time. These are unusually intense emotions, extreme issues with eating and sleeping, and an inability to recognize those issues, which can stand in the way of getting the proper care. Oftentimes, when people are experiencing a mood episode, they are unaware, but those around them can notice those uncharacteristic behaviors. There are three types of episodes that I want to talk about with you. There are your manic episodes, hypomanic episodes, and depressive episodes. During a manic episode, people feel like they are on top of the world. They have tons of energy and they are just wired. During a manic episode, people can go days without eating or sleeping and still feel full of energy. When you're having a conversation with someone going through a manic episode, it may be challenging to follow that conversation because they have all of these random thoughts that are rushing at them, and what they're going to say is going to be all over the place. During a manic episode, people feel as though they can get so many things done. So the to-do list is very different than our typical to-do list. You may decide, today, I'm going to clean my closet. That's a realistic expectation there, right? If you are experiencing a manic episode, you will not only clean your closet, you will paint it, you will change the flooring, you will install shelves, you will buy shoe racks and dozens of shoes to fill those shoe racks. During a manic episode, there's very poor judgment. People make some poor choices. Sometimes that's eating or drinking too much, spending money that they don't have, or even reckless sex. So during a manic episode, these are the symptoms that you will likely see. Not necessarily all of them, but the majority. Hypomanic episodes are a little more challenging to identify. When someone is having a hypomanic episode, they're getting things done. Okay, they are handling their business and they are going about day-to-day activities without any problems at all. They feel fine, so they don't think that there's anything wrong, but people around them will notice uncharacteristic behaviors. We want to be very cautious because people who experience hypomanic episodes are hesitant to get care because they don't see the issue. Depressive episodes. During a depressive episode, people feel worthless. They feel hopeless and may even have thoughts of wanting to hurt themselves. They may not sleep. They may sleep too much. They may not eat. They may eat too much. It's a feeling that what you have to say or contribute is unimportant. They tend to withdraw and may even seem as though they're moving in slow motion. They have a hard time concentrating and a very hard time making decisions. They're forgetful and tend to not enjoy the things that they used to enjoy before. So these are your depressive episodes. So we've talked about manic, hypomanic, and depressive. We want to know what the risk factors are, right? Well, we're not 100% sure, but there are a few things that researchers have found. There's a difference in the brain structure and functioning of someone with bipolar disorder that differs from someone who may not have it. Even though this information is helpful, it's not likely that your clinician is going to do diagnostic brain imaging to make a diagnosis. There's also genetics. So if Mama had bipolar disorder and Uncle James has bipolar disorder, if you are experiencing these symptoms, it's likely that you have bipolar disorder. Now, for older generations, they may not have called it that. People may not have been seeking services at the time, or it may not have been diagnosed properly. But you know that there are times when Mama would bake 18-pound cakes and 15 sweet potato pies overnight. That's not common, okay? So genetics, that plays a part. When are you diagnosed? People are typically diagnosed during their late teen years and early adulthood. So when children present with these symptoms, it can be very challenging for a clinician to identify, because we have to determine what's the difference between a normal, typical developmental stage and what's abnormal. Children are growing, children are learning, children are trying to understand things, and their way of expressing themselves is not like you would see in an adult. So we have to be very cautious as clinicians, because we want to make sure that we are calling it the right thing. Diagnosis. Proper diagnosis and treatment are essential. Okay? In order for people who suffer from bipolar disorder to have enjoy life and be able to do the things that they love to do, we first have to know what we're dealing with. Talking with your doctor or a licensed healthcare professional, that should be the first step. Let me say that again for the people in the back row. Your doctor or licensed health professional can make that diagnosis, not your niece who took Psychology 101. She can't do it. Not Aunt Sally, who has read everything on WebMD and she knows that's exactly what Junior is dealing with. Aunt Sally can't make that diagnosis. If you are going to a licensed healthcare provider, you can rest assured that you are dealing with someone who knows what they're doing. They have the experience to diagnose and treat bipolar disorder. If you start with your PCP, as most of us do, then your PCP will likely give you a physical exam and do some diagnostic tests to rule out any physical issues. Your PCP may then decide to refer you to a licensed healthcare provider. Okay? This provider will help you through those issues. Okay? This licensed provider will be able to take care of you. Now, in making a diagnosis, there are three main types of bipolar disorder. There's bipolar 1, bipolar 2, and cyclothymia. Okay? Bipolar 1 consists of having manic episodes that last at least 7 days, or they're so severe that the person has to go to the hospital. Okay? Episodes of depression can also be present. You can even have manic and depressive episodes at the same time. Bipolar 2 consist of having depressive episodes and hypomanic episodes. Remember, these are the folks who are getting it done day to day, and they typically don't recognize any problems at all. Usually these depressive symptoms that they have will last a couple of weeks. Okay? So that's bipolar 2. Cyclothymic disorder or cyclothymia. This is defined as having periods of hypomanic symptoms, okay, so hypomanic episodes, as well as periods of depressive episodes that last at least 2 years in adults and 1 year in children. Sometimes things don't fit into one of those boxes. So you may hear someone say bipolar disorder unspecified. So that basically means this is what we think it is. It doesn't quite fit. So this is a more general category. Once someone is diagnosed with bipolar disorder by a licensed healthcare professional, treatments will be discussed. There's a combination that works really well: medication and psychotherapy. Psychotherapy is talk therapy. This is where you talk about the things that you're experiencing, and the therapist will help you develop coping skills and be able to recognize when your mood is starting to peak or to have a downfall. That's psychotherapy. The other is medication. A lot of people are hesitant to try medication. Well, you know, my grandson was put on that medication and it did not turn out well. Or I'm just going to pray about it and talk to my pastor. That'll do it. Some people may even decide, well, I'll just drink a cup of apple cider vinegar every morning. That's going to take care of it. No, it won't. Medication and psychotherapy. The type of medication that's typically prescribed is a mood stabilizer. This is going to keep you from having those peaks and valleys. Okay, so it helps to kind of regulate that mood. There's some things that you need to talk about with your healthcare provider to make sure that they have a good overall understanding of what things are like for you day to day. You may have issues with anxiety or issues with sleep or even psychosis. If those are identified, medications may be prescribed in addition to your mood stabilizer to improve those symptoms. People who are taking medication, ask about the risk and benefits. Talk about those before you take a single dose because you want to fully understand what to expect, timelines included. Now, there are side effects for everything. You have side effects from taking a multivitamin. So there's a possibility that you will have side effects from the medications that you're prescribed. That's why it's essential that you tell your prescriber about all other scripts that you're taking, as well as over-the-counter medications and supplements. Okay? We have to know what else you're taking because some medications don't play well with others, and it can cause your medication to have a boost, or it may even cause it to counteract it and not provide benefit at all. You also want to talk with your doctor about how often to take your meds, which is typically daily, and what to do if you have a problem. Your prescriber starts the medication, and it should be your prescriber who makes changes or stops your medication. If you are having a bad day, don't take 2. If you are feeling better, don't cut your dose in half. You're probably feeling better because your medication is working. You want to call your doctor before you make any changes at all, okay? And they will talk you through it. It may be possible that there may be another medication that may be more appropriate. But we want to do that. Not taking your medicine properly could result in some type of rebound effect. So symptoms can come back tenfold. Other than taking part in your treatment plan and adhering to your psychotherapy and your medication plan, it helps if you do a little more. There are things that you can do that are beneficial for us all to do daily. Exercising. Doesn't matter if it's jogging, taking a brisk walk, cycling, doesn't matter. Just get moving. When you exercise, it's helpful for the heart and the brain. It also helps with anxiety and depression. So exercise is essential. When you have mood changes, it's important for your prescriber to understand when those things occur so we can try to identify those patterns. So keeping a chart of when your mood seems to fluctuate, as well as your sleeping patterns or any other life experiences. Taking note of those will be very helpful for your prescriber. Now that I've given you the breakdown, I hope you have a better understanding of what bipolar disorder is and what it is not. I hope you found this helpful. If you enjoyed this episode, please like, subscribe, and share. That way, you'll never miss an episode. Thank you for joining the breakdown. See y'all later.